Hello, thank you for tuning in. I am Dr. Jeffrey Brown, and you are watching Power to Heal. We are in our last video, our third video on our series on endometriosis. And so our last talk about endometriosis is about hormone imbalance. Now, endometriosis is an estrogen-dominant condition, and it's associated with progesterone resistance. Progesterone is supposed to keep estrogen in check, but with endometriosis, progesterone is on strike and doesn't want to go back to work. As a result, estrogen goes out of control. Now, progesterone resistant basically means that the endometrium is unresponsive to the normal progesterone activity and signaling pathways. Progesterone resistance is also being linked to dysmenorrhea, which is a fancy way for saying painful periods, dyspareunia, another fancy way of saying painful intercourse, PCOS, and also breast cancer. Now, what are some of the thoughts out there about the causes of progesterone resistance? Well, the first is chronic inflammation. We talked about this in our last video. Aberrant gene expression, epigenetic alterations, endocrine disruptors. And these are things that disrupt the normal estrogen, progesterone, and other hormone functioning. So here are some examples of EDCs, or endocrine disrupting chemicals, plastics. So please don't store your food or heat them up in plasticware. Cleaning chemicals, use green products. Some of our personal products, deodorants and makeups and shampoos and sanitizers, some of these have indices in it. And also foods. So make sure you eat foods that are free of hormones and antibiotics. So lab testing of our hormones should be done during your luteal phase. And that basically means between days 19 and 21 of your cycle, where day 1 is the first day of your period. All right, this is the time when progesterone and estrogen are at the right peak, the right balance, just during that time. So we want to check progesterone. You want to check the 3 different estrogens, testosterone, and also do a complete thyroid function profile. It's important to make sure that these levels are optimal and they are balanced in the proper ratios. Being in a so-called normal or reference range basically implies that all women of all ages and ethnicities wear the same shoe size, but we know that is not true, right? There are 2 main estrogen receptors, alpha and beta. Estrogen receptor alpha is responsible for growth, and estrogen receptor beta is responsible for controlling growth and also inflammation. And so we know that endometriosis is a condition where the uterine tissue grows outside of the uterus. This is an example of uncontrolled growth. So the balance of the estrogen receptor alpha to the estrogen receptor beta, in the breast tissue, endometrium, ovarian tissue, is vital to the health of women. So let's talk about treatments. So the most common treatment is the use of progestins and low-dose oral contraceptives. Now, we also know that up to 1/3 of all women with symptomatic endometriosis, they don't respond to this treatment. Birth control does not get to the root of the problem. It just masks the problem. And not to mention, it increases the risk for candida overgrowth, which I spoke about in the first video of this series. Progestins, unfortunately, are confused with and interchanged in the literature with progesterone. You'll hear doctors call progestin progesterone, but progestin is not progesterone. Progestin is synthetic, it's man-made, and does not have the same biochemical structure that is in our bodies. Consequently, it's going to have different biological responses. All right, progesterone is a natural occurring hormone, in our body. A lot of doctors have been taught and believe that if you don't have a uterus, you don't need progesterone, and that is so far from the truth. Progesterone is more than just a reproductive hormone. All right, there are progesterone receptors, in the brain, in the gastrointestinal tract, in the lungs, nervous system, pancreas, in our liver. Progesterone is involved in a lot of things. So let's talk about a few of them. It helps with sleep because it has mild sedative effect. It helps you with that healthy looking skin. If you have acne, you probably have low progesterone. It helps maintain bone density because it increases the formation of new bone cells. Promotes repair and formation of the myelin sheath, which is the layer surrounding our neurons. All right. It's also a neurosteroid and is neuroprotective and has neuroprotective effects. All right. It helps promote healing in brain trauma and also slows the progression of Alzheimer's disease. It also helps regulate our mood and PMS. It has anti-anxiety effects. It's a natural diuretic. If you get swollen ankles and fingers, that's progesterone. We need to help get rid of the extra fluid. It also has anti-proliferative effects on estrogen. In other words, it protects against cancer. And that's just a short list of all the important things that progesterone does in our body. Progestins, on the other hand, they're used in contraception. and part of the conventional HRT to protect the uterus from cancer when they're treating hot flashes. All right. Progesterone also increases the risk of breast cancer. It increases the risk of coronary vasospasms and heart disease. It increases the risk of getting cancer of the breast and ovaries. And it is progestins that increase the risk of breast cancer, not estrogen or progesterone. Now, there's a lot of symptoms of progesterone deficiency, and let's go through them. It's going to be anxiety or panic attacks, cystic or lumpy breasts, ovarian cysts, fibroids, excessive facial and or body hair, feelings of loneliness or just feeling useless, miscarriages, breast tenderness, irregular menstrual cycles, lack of menstrual periods, period pains, hallucinations, feelings of insecurity, binging, hair loss, insomnia or sleep disorder, water retention, mood swings, irrational fears, palpitations, and migraines. So if you suffer from any of those symptoms, you probably have low progesterone. Progesterone replacement comes in a variety of forms: capsules, troches, which are sublingual wafers, under the tongue, creams, or pellets implanted under the skin. Now, optimizing and balancing hormones are essential in treating endometriosis. You don't have to suffer every month. If you follow my holistic approaches from these 3 videos, you will no longer have to fear that time of the month. Thank you for watching. I hope you enjoyed this series. If so, please share with your family and friends. Also, please subscribe to our channel if you'd like to learn more about how to improve your health. Remember, you do have the power to heal. Thank you.